So hello my dear students, welcome back. So today in this session we'll be discussing previous year asked questions from dermatology. So let us begin with the first question. So here this was image based question and they asked that this female patient had history of fever and then started developing this erythematous lesions over cheeks, sparing nasolabial fold associated with photophobia as shown in the image. What is the diagnosis? So very easy question and all the points are pointing towards which condition? Yes, correct. That is systemic lupus erythematosus, that is SLE. And why this is a case of SLE? Because this is more common in females and generally patient have systemic features like fever or arthralgia, joint pain. Patient have photophobia, that is the condition can aggravate on sun exposure, and these are generally erythematous rashes which start developing over cheek and nose, giving rise to a very characteristic butterfly rash, and these rashes generally spare this nasolabial fold. While nasolabial fold can be involved in rosacea, melasma have brownish discoloration, while dermatomyositis can have heliotrope rash which are slightly violaceous or reddish and they are around eyelids. So that's why this is a case of SLE. Moving on to the next question. Here they are saying that a male patient suffering from alopecia. Alopecia, that is hair loss, and you can see in the image as well that there is a patch of hair loss present here. There are multiple such patches. Which of the following nail change is likely to be associated? So they are asking that what is the common nail change associated with this condition, and this is which condition? Alopecia areata. And the most common nail change associated with alopecia areata is nail pitting. Pitting of nails is associated. So pitting of nail is associated with alopecia areata. This pitting is superficial and regular. While in psoriasis, it is irregular and deep. Pigmentation of nail can be seen with minocycline. Pterygium of nail is seen in lichen planus, while yellowish discoloration of nail can be seen with underlying systemic conditions like jaundice, that is liver disorders. A patient presented with clustered white lesions on buccal mucosa opposite to the first and second molar and are pathognomic for. So, do you know any condition where such clustered white lesions are seen on the buccal mucosa opposite to the lower second molar? Yes, this is Koplik's spots seen in measles. So these are very characteristic of the pre-eruptive stage of measles, and these generally develop on the buccal mucosa opposite to the second molar. Identify the phenomena shown in the image, and what you can see in the image, there are multiple lesions, but there are few lesions which are present in linear fashion. So whenever patient scratches or there is trauma, multiple lesions start developing along the line of trauma in linear fashion. This is known as Koebner's phenomena. So this is known as Koebner's phenomena, and this Koebner's phenomena is also known as isomorphic phenomena. So another name of Koebner's phenomena is isomorphic phenomena. Iso means similar, morphic means morphology. So similar type of morphological lesions start developing along the line of trauma. Now, all of you know Grotton's papules, they are seen in dermatomyositis. Reverse Koblenz phenomena is when patient produces trauma and the lesions heal. This can be seen in psoriasis. So, in psoriasis, both are seen, that is Koblenz phenomena and the reverse Koblenz phenomena. And Nikolsky sign, all of you know, can be seen in various conditions like pemphigus, Steven-Johnson syndrome, TEN, as well as staphylococcal scalded skin syndrome. Which drug can be used as nail lacquer in the treatment of onychomycosis? So we all know that generally we don't use cream, lotion, solution for onychomycosis because the nails are pretty hard and we need something which stays there over nails for a longer duration like nail lacquer. And the commonly used nail lacquers are amylorphin nail lacquer, which is antifungal agent, cyclopyrox, olamin, and also terbinafine. So these are commonly used nail lacquers for onychomycosis. These have antifungal properties and they stay there over nails for a very longer period like nail paints. So they are applied over the nail with a brush and they come in a small nail glass bottle like nail paints. Okay. So these are known as nail lacquers and they are used in the treatment of tinea angum, that is onychomycosis. So I hope this session was useful for all of you. Thank you very much.